Dear expectant mothers, the following video clip will introduce information on how to prevent Group B Streptococcus GBS infection in newborns. Please listen carefully.
Nurse, what is GBS?
GBS is a bacterium commonly colonized in the human intestines, as well as the urinary and reproductive systems. It is not a sexually transmitted disease. About 10 to 30% of pregnant women are colonized with GBS in the vagina or rectum.
How does GBS affect pregnant women?
Most pregnant women who are infected with GBS have no symptoms. A small number of pregnant women may develop urinary tract infections.
So, how does GBS infection affect the newborns?
Actually, GBS is the most common cause of severe infection in newborns. This is because a woman colonized with GBS can pass the bacteria to her baby late in her pregnancy. About 1 out of every 100 to 200 pregnant women carrying GBS will give rise to GBS infection in the newborn. GBS infection can be classified as early or late onset.
What is early onset GBS infection?
In early onset GBS infection, the following signs and symptoms usually occur within several hours or days after birth: breathing problems, unstable heart rate and blood pressure. Lung infection, blood infection and meningitis are the most common presentations. Gastrointestinal and kidney problems can also occur. In Hong Kong, the incidence of early onset GBS infection is around 1 per 1,000 births. Early onset GBS infection causes serious illness with a death rate of around 5 to 10%.
What is late onset GBS infection?
In late onset GBS infections, the symptoms usually occur a week to several months after birth. Meningitis is the most common presentation. Late onset infection occurs less often than early onset infection.
How can I know if I have GBS?
The antenatal clinics of Hospital Authority and the maternal and child health centres of the Department of Health provide a GBS screening test for pregnant women. The objective is to identify women who are colonized with GBS and provide them with appropriate treatment so as to reduce the chances of their newborns developing early onset GBS infection.
So, how is GBS screening test done?
The test is done between the 35 to 37 weeks of pregnancy. The doctor or nurse will swab your vagina and rectum and then send the sample to the laboratory for testing. The procedure is simple, fast and painless, and a speculum is not required.
What happens if the GBS test is positive?
A positive test result means that the pregnant woman is colonized with GBS. We recommend the mother to receive intravenous antibiotics during labour. This greatly helps to reduce the chances of the baby being infected with GBS.
If antibiotics are given during pregnancy for women who are colonized with GBS, will this protect their newborns from being infected?
Receiving antibiotics during pregnancy is not an effective way to get rid of GBS, because colonization status can change over the course of pregnancy. The bacteria can reappear following the antibiotic treatment. Therefore, the most effective way to prevent the newborn from being infected with GBS is to receive antibiotics during labour.
Should every pregnant woman undergo GBS screening?
Actually, not every pregnant woman is required a GBS screening. We recommend some women to receive antibiotic injections during labour. For example, women who have previously given birth to an infant with GBS infection, women who have developed a GBS-related urinary tract infection in the current pregnancy, or women who have already been found to be colonized with GBS before 35 weeks of pregnancy.
So, if I have planned a caesarean delivery, do I still need the GBS test?
We recommend that pregnant women who have planned to have a caesarean delivery should still be screened for GBS.
What will happen if I do not have the test, or the test result is not known during labour?
Medical professionals may give you antibiotic injections if the following conditions are present during labour. You have gone into labour prematurely, that is, before 37 weeks of pregnancy. You have a fever of 38 degrees centigrade or higher during labour, or your waters have broken for more than 18 hours.
Are there any side effects from antibiotic injections?
There is a possibility of allergic reaction, but the chance of severe allergic reactions causing a life-threatening situation is very low. Health professionals will keep a close eye on the women who have received antibiotics. After the antibiotic injection, if you develop any skin rash or have breathing difficulties, you should report to the health professionals immediately.
If I have received an antibiotic injection during labour, will my baby be completely protected from the infection?
Antibiotic injections during labour can greatly reduce the chances of early onset GBS infection, but it cannot totally prevent all early onset infection, because your baby may also become infected through other sources.
If I have a negative result, does it mean that my baby will not be infected?
The reasons for a negative test result may be the woman has never been infected with GBS, or the woman has no GBS colonized at the time of testing, or it may be a false negative report. So even if the screening result is negative, your baby still has a small chance of becoming infected.
If I have GBS colonization, will my baby need any treatment after birth?
Your baby will be referred to a paediatrician after birth. The paediatrician will determine if the baby needs any treatment according to the following factors: whether the baby has any signs of infection, whether the baby was born at term, and how much antibiotics have been given during labour.
So, when will I know my screening result?
The result is available about a week after the test. You will be informed of the result at your next antenatal checkup.
If I plan to give birth at a private hospital, what can I do?
To ensure your private doctor knows about your GBS screening result before the onset of labour so that timely antibiotic injections can be given if needed, we recommend you approach your private doctor for testing.
Oh, I understand now. Thank you very much.
You are welcome. I believe all of you now should have a better understanding about GBS prevention in newborns. If you have any further inquiries about GBS screening, please consult your health professionals. Wishing all expectant mothers and their babies a healthy and happy life.